Welcome to the latest MS Hear from the Experts webinar. This series is helping people better understand multiple sclerosis, highlights MS-related resources, plus provides tools and tips to navigate their MS journey with more knowledge and confidence. Our intention is to help you learn more about this disease, treatments, research, wellness strategies, our programs, and much more. I am Sue Whitaker. I was diagnosed with MS in 1996, and a year later, my association with MS Canada came through the MS Bike event, and I've been riding every year ever since. I've been a volunteer with the MS Society from that point in time, and am currently an MS ambassador here in British Columbia, and I'm your moderator for today's broadcast. We'd like to take this opportunity to share that as of January 1st, there has been a name change and the Society is now called MS Canada. Under this new name, we will continue to fulfill the mission of the MS Society of Canada and the MS Scientific Research Foundation, building upon our 75-year history of supporting the MS community and funding the most promising research to identify the cause and cure of MS, plus the development of new treatments. It is a new name, but we have the same vision of a world free of MS. Before we get started with our presentations, let's briefly go over a couple of housekeeping items. Your microphones have been muted and will remain muted for the entirety of the broadcast. If you have a question, please type it into the chat box and we will try to get to as many questions as possible following the formal presentation. Please note that questions pertaining to specific personal situations likely cannot be answered in this type of venue, and we recommend contacting your personal MS healthcare team or perhaps contacting the MS Knowledge Network for those questions. This session is being recorded and will be available soon on our website in English. We are also adding French subtitles to the recording, but that version won't be available for several weeks. The recordings will be available on our website under National Webinars from the archived page and on our YouTube channel. A Facebook Live recording will be available also. Also, please note that the MS Society of Canada, or MS Canada, does not approve, endorse, or recommend any specific product, therapy, or service, but provides information to assist individuals in making their own health and wellness decisions. Today's broadcast is an opportunity to learn more about enhancing your wellness by working with your pharmacist. Our expert today is Heidi Whitke. She is a pharmacist with diverse experience in both the retail and long-term care industry, focused on delivering clinical programs that help drive patient safety and overall health outcomes. She has worked in various clinical settings, managing chronic disease and polypharmacy, while collaborating with patients to improve management of their overall health and well-being. Heidi is currently working as Director, Specialty and Virtual Services at Rexall, enhancing both patient access to virtual services and specialty medications in the community setting. Heidi graduated from the University of Toronto's Faculty of Pharmacy and is currently a member of the Ontario Pharmacist Association's Pharmacy Practice Committee. Welcome, Heidi.
Thank you so much, Sue, for that introduction. Really excited to be here. So thank you so much for this opportunity. Really excited to, speak to all of you really about what's passionate to myself and really excited about the role that the pharmacy and the pharmacists have really played over the last number of years. And really this is an opportunity to share with each of you how you can really tap into your pharmacist and really they can really help to support your overall health and wellness journey. And when I reflect back, I've been practicing for over 15 years now, and it's really amazing to me to see the shift in the responsibilities and roles that pharmacists have taken on, and just that heightened awareness about the role that your community pharmacist plays even within the healthcare system. So many of you today may have those really strong working relationships and patient relationships with your local pharmacist, and many of them may have known you for a number of years and really are intimately sort of involved in both the caregiving side of it, you as a patient, but also supporting the broader family. And when I think back about, the number of years and the changes that has happened over this profession. It's really exciting to see, continue to be the most accessible healthcare professional in Canada. And they are equipped with the knowledge and the skills to be able to support patients with their healthcare needs, and really not just in that context of filling prescriptions. And we'll kind of go into how that scope of pharmacy has really changed and how really it's meant to help to support the gaps that we've seen in the healthcare system and really help our patients and our customers along their journey and really ensure that we're meeting your health outcomes. So it's not just so much about interacting when you're sick, but really looking at interacting with the pharmacist, even at the early stages of life. And whether it's, as a prescriber, and we'll get into, again, certain jurisdictions within Canada, pharmacists can now prescribe, or maybe it's as an immunizer, where you've had your COVID vaccine from your local pharmacist, or that first point of contact for the healthcare system. So you have a question about a new diagnosis or a new therapy. Oftentimes, the pharmacists are there and they're easily accessible and seen as that valuable healthcare resource. So there's a number of different areas that pharmacists currently work in. And it's really interesting because right now, patients actually see their pharmacist about 1.5 to 10 times more often than they see their primary care physician. So really think about all those different aspects and opportunities to have touch points and really help that continuum of care and ensure that, patients are taking their medications as prescribed, but also really connecting and having those conversations to see, what are your goals of therapy? What would you like to accomplish, so that we're ensuring that, we're making this as seamless as possible to take your medications to achieve those health outcomes. The other interesting fact is that most Canadians live within 5 kilometers of pharmacy. So again, it really speaks to that accessibility component and really being, a great resource for a lot of Canadians coast to coast. This slide always, just makes me smile. I think I'll kind of go into some of the stats, but you can see again, there's a number of us across the provinces, been trained for a number of years. So this is a degree that we achieved 4 years of at least minimum university to achieve the licensing. And what's really great about, I think pharmacists, you may have seen them in different settings. So it's not just, your retail community setting, but also in the hospital setting. Many are working within these interdisciplinary primary care clinics as well. Some of them are working in manufacturing and industry, government, associations. So really sort of across the broad spectrum of the industry, you'll see a number of different pharmacists supporting health outcomes for patients and Canadians. And they really, as I mentioned earlier, that traditional role of just dispensing has really expanded it. And pharmacists across Canada continue to really deliver on a range of innovative services. So whether that's medication reviews, chronic disease management, so diabetes or hypertension, supporting with MS, there's immunization services, as well as wellness programs. And most of the provincial governments now have also recognized prescribing authorities for a lot of different pharmacists with varying scopes across the provinces. And we'll dig a little bit deeper into that as well and kind of share with you some of the different opportunities to tap into those services. And they really do complement and are work in collaboration with your primary care physician, with your nurse practitioner, to really support in facilitating access to medications. Maybe it might be ensuring that you have those convenient refills so that, less time is sort of spent on, chasing down medications or prescriptions. So really, that pharmacist and that pharmacist team can really help to support and ensure that you have that easy access to those medications. I love this survey. So the Canadian Pharmacists Association a number of years ago put out a survey to really ask Canadians, what did they think of their pharmacist just ahead of World Pharmacist Day. And it was interesting because, I think it was really resounding in terms of just the recognition for some of the efforts that the profession has made in the impact in the lives of Canadians. And this is certainly true that we've seen in the backdrop of the pandemic. recognizing again that they were accessible, open, when sometimes other healthcare providers were providing services, whether virtually or some offices were even closed. So allowing, those pharmacists to be able to support with COVID immunization, I think that really recognize the important role that they play. And certainly, I think the public recognizes that. And it's great to see that, a lot of Canadians do see pharmacists as a primary ally in the healthcare system. And that I think recognizing that they probably could do some more too, and hoping to see a bit more scope of practice extended to pharmacists to really close the gap in the healthcare system. So you can see, we'll get into some more details exactly, how you can interact with your pharmacist. And many of you may do this today as well. And we'll review a few of the different scopes of practice as well. Because this certainly has changed, and certainly there's been some new announcements, even in the last few months, that we'll get into it. So really, when we look at the scope of practice, it does vary across provinces, but you'll see here at the top are different provinces and territories. And governments have also taken note as they continue for ways to alleviate strain on the healthcare system. And how can we better utilize the healthcare professionals that have been trained, have the expertise to really help to emerge as a really viable solution to the healthcare system and really address some of the system gaps. And we saw that certainly during the pandemic, where more authority was given to pharmacists as well to really support patients. So whether that was in just ensuring that patients had access to medications, maybe they ran out of refills. So, pharmacists can help to refill those medications, even though you might have no more refills left, for example. The other thing that we've also seen is that it wasn't just the pharmacist's scope of practice that expanded over the pandemic, but so has our technicians. And so the technicians that work with us in, whether it's the hospital or again, a community pharmacy, they've also taken on a lot of additional roles and responsibilities on more of the technical checks. So, helping to ensure, again, that's the right medication, the right patient, the right dosing. They really help to ensure that the technical aspects of that prescription is filled correctly and safely. And that really helps to free up the pharmacist's time to interact more with patients so that, they can get out from behind the counter and really engage with patients and complete some of those medication reviews, complete the immunizations, really help address some of their chronic medication management as well. So we've seen, again, this emergence even during with prescribing of Paxlovid, which is a medication that is often used. So if you've been just recently diagnosed with COVID, it is a medication that can help to relieve some of the symptoms a little bit earlier. So now pharmacists are able to support on that. We've also seen the emergence of pharmacist-led walk-in clinics in certain provinces. So in Alberta, where pharmacists are able actually to prescribe, we've seen a lot of now clinics run strictly by pharmacists. So in that province specifically, some pharmacists with special designation can actually prescribe medications. So things like medications for diabetes or blood pressure or thyroid medications, they have a special designation that, again, really supports in providing access to care and really in that collaboration too with the primary care physician. So it's great to see some of these expanded scopes of practice here. And we'll get into a little bit more detail around the minor ailments and exactly what that is. But I just wanted to showcase this slide because I think it really summarizes really nicely some of that scope of practice based on the province that you currently live in. So in other places that you'll see across the board that pharmacists can make therapeutic substitutions or they can adjust a formulation. So let's say you're not tolerating your solid medication. So it's a tablet or a capsule, for example, and you're having difficulty swallowing it. If there's a commercially available liquid format, you can talk to your pharmacist and they can easily switch that formulation for you so it's a lot more palatable. They can also, as I mentioned, extend your prescription. So let's say you run out of refills and you can't access the physician or the physician's office is closed. a lot of times you can walk into your pharmacy, again, depending on the province, and ask to have that prescription extended. So if you've been stable on that medication, there's been no underlying changes to your overall health or medical condition, that pharmacist can renew that prescription for you. And again, this is just to help ease that access to medication so that you're not having to delay or wait for refills or new prescriptions. The other pieces too is around immunization. So we've really seen too, from flu shots to the routine immunization and travel vaccines, that your pharmacist can offer access to those vaccines and injections. So this continues to expand, actually. So it's great to see that a lot of the publicly funded vaccines are ones that can be administered by your pharmacist. So things like, your flu shot, which many of you may have actually received from your pharmacist. Same thing as your COVID. But more and more too, we're able to do like your pneumococcal, your shingles vaccines. All of these can be administered by your pharmacist. The other piece too that is another great opportunity is, in terms of travel. A lot of pharmacists have a passion for travel medicine. Some have different designations to support to be able to really provide you with a comprehensive review and a travel consult. So this is another area where if you're leaving on a trip or a vacation, chat with your pharmacist, because they can really support you in, identifying which vaccines you might require, which prescription medications you might need, or any over-the-counter medications as well. And again, in certain provinces, they can actually prescribe some of those travel vaccines and not, including the administration. So again, it just allows that easy access to those types of vaccines. So in terms of publicly funded, so these are, again, services that are free of charge to the patient. So when you walk in, and I encourage all of you, actually, if you haven't had a chance or to do a comprehensive medication review with your pharmacist, it's a great opportunity, once a year, kind of sit down and really just kind of do a holistic review of the medications that you're on. So that's not only just your prescription medications, but it could be your supplements, any herbals that you might be taking, because the pharmacist is well positioned to be able to counsel you and provide recommendations on potential drug interactions, potential drug nutrient interactions. So sometimes certain supplements like calcium might interact with certain medications, or the pharmacist may recommend that you take those at different times of the day to avoid any decreased effectiveness of one medication. So by going through these comprehensive medication reviews, they'll also, chat about lifestyle, and, some patients might be interested in smoking cessation. So this is another service that the pharmacist can certainly support. And the other pieces too is that they really take, again, that holistic approach and really want to hear what your treatment goals are. So we really work closely with you to try to ensure that, if you say, I'm taking a lot of medications, I'm feeling that, I'm taking, sometimes we see 7, 8, 9 medications that someone may take. So it's very overwhelming. So one of the things that your pharmacist can also do is look to see if we can streamline that and try to reduce that pill burden. So is there something that can be taken, once a day versus twice a day? Sometimes there's combination therapies as well that can be used together. So, there's 2 medications in one tablet. So that just helps to reduce, again, sort of that pill burden. And that's something that your pharmacist can certainly support on and help you with, as well as, chronic disease management, and really support on the symptom management side, or, helping to achieve your wellness goals. So highly encourage, everyone to have that medication check with your pharmacist. It's a great opportunity, again, once a year to review, go through it, and, look at ways that you can streamline certain therapies that you might be on, or even speak to your pharmacist about potential side effects that you might be experiencing. So I just want to chat a little bit about minor ailment prescribing. You may have been hearing a little bit about this in the news. Recently, Ontario in January recently caught up to many other provinces across Canada where the government has now allowed pharmacists to prescribe certain types of medications for minor ailments. And this program was really has started to really improve access to these healthcare services by expanding the role of the pharmacist, allowing them to prescribe where appropriate for these particular conditions. So in Ontario specifically, there's 13 different minor ailments that pharmacists can prescribe for, and you can see a few of them here on your screen. So there's everything from nasal allergies. So going into spring, a lot of patients suffer from seasonal allergies. Well, there's things that the pharmacist can do to assess and see if there's maybe a prescription medication that might be a little bit more effective or a little bit stronger to help you with those symptom relief. Same thing with urinary tract infections. So this is another area that we actually have seen a lot of uptake in. So, for anyone who has suffered from a urinary tract infection, your symptoms, and this is something you want to treat very quickly and don't necessarily want to wait. So you can walk into your local pharmacy and that pharmacist will assess to make sure, again, you're eligible and you're appropriate to receive a prescription medication. But essentially, you could leave that day with your antibiotic and start treatment right away. So it's really helping to relieve those symptoms and ensure that there's quicker access to medications. The other piece too that's really exciting is that BC just announced on June 1st, so just last week, that the pharmacists in that province are also authorized to prescribe 21 minor ailments, as well as contraception needs for BC residents. And so again, depending on the province, the number of minor ailments might be a little bit different, but essentially when we're talking about minor ailments, it's really any health condition that can be managed with minimal treatment or self-care strategies. They typically tend to be short-term. Lab results might not be required. There's sort of low risk of what we call treatment masking underlying conditions. So again, they're usually self-limiting, short duration. So these are the types of ailments that you see, so, and again, anything from supporting any dermatology or dermatitis to hemorrhoids, to cold sores, to acne. Again, depending on the province, these minor ailments prescribing might change a little bit might be slightly different, but essentially it's really to help provide that quick relief to patients for these conditions that are sort of short-term and self-limiting. In many of the pharmacies too, you don't need an appointment. You can walk in and see that pharmacist, and essentially, within a few minutes, they can, again, complete that assessment, ask a series of questions. I should also say they also look out for any red flags. So if there is anything that, through the questioning or through you sharing your symptoms with that pharmacist that seems outside of the scope of the minor ailment, they will absolutely refer you to your physician as well. The other piece that's really important of this program and this is really ensuring that continuity of care. So the other requirement that pharmacists must follow is that they need to follow your primary care. So you need to notify the primary care provider that you completed, this assessment for, let's say, urinary tract infection and what was the outcome and what prescription you may have prescribed for that patient, so that the physician is aware and there's just that continuity of care. So this is really exciting. I think this has really been sort of a game changer too for a lot of patients. And I often hear, especially for our rural communities where primary care physicians may not be as easily accessible, that this has certainly been a welcomed program for patients. So I think we're going to continue to see some additional minor ailments added to this list. But for now, really exciting. And again, with BC just recently announced June 1st that they can do the prescribing for those 21 minor ailments, as well as the contraception. And BC actually just recently also covered any contraceptive needs for BC residents. So that's everything from the pill to the IUD, to the morning after pill as well. So this slide just talks a little bit about the full scopes of practice. So we sort of touched on, the medication reviews. We talked about pharmacist prescribing, and some of the other components that I just wanted to touch on too is sort of the point of care testing. So this one is offered, again, depending on the pharmacy, but a lot of pharmacies will offer a point of care testing. And what I mean by that is it's actually a device that can measure certain lab values. So for example, A1C. So if you're diabetic, your A1C is your blood sugar over a 3-month period. So this is a good measure of how well controlled your blood sugars are. So these are the types of point of care testing that might be available in your pharmacy. So we talked about A1C. There's also cholesterol testing that you can also get from point of care testing, as well as there's also sometimes like your strep throat. So these are services that are offered at your local pharmacy. On top of course, your vaccinations. And a lot of times you don't need to book an appointment. This can be a walk-in. The other piece too, in certain pharmacies that do offer is virtual. So there is that component. We've heard from, patients just the convenience piece of having to, just talk to your pharmacist from the comforts of your own home. So there are, again, some pharmacists that will complete some virtual consults over the phone with you so that you have that you can have that private conversation, one-on-one with your pharmacist. It's a secured video or phone conferencing. And again, really allows for those, allows you to have that intimate conversation with patients. I just want to touch a little bit on medication adherence tools too, because this is another component that you can really talk to your pharmacist about as well. Many pharmacies will offer these different types of compliance tools that really helps to ensure that you're taking your medication on a regular basis. Just recently I saw, with the World Health Organization, they had looked at adherence, and right now adherence to long-term therapy only averages about 50%. So a lot of, patients don't necessarily take the medication as prescribed by the physician. And there's a multitude of reasons for that. But certainly if you're finding that you have a lot of medications, it's difficult to kind of keep track of when you should be taking it. These different types of compliance tools are really great. So some of you may already have like blister cards, and there's different formats. There's the blister cards, they're sometimes in strip packaging, but at the end of the day, they're all there to really help to support ensuring that you're taking your medication as directed and at the time is indicated as well. There's also other tools that are available through pharmacies sometimes too, so an auto refill. So what this does is it really takes the guesswork out of when your next refill is due. It automatically refills it upon your consent. That, in 3 months' time, for example, that medication will be ready. And oftentimes the pharmacist will either call or send you a text to let you know that it's available. We also have, this is specific to Rexall specifically, but we do have other through like a loyalty app that patients can also connect with their pharmacy, have access to their medication profiles, send in their prescription, take a photo of their prescription and send that to the pharmacy so that they can start to process that right away. So many pharmacies as well have, similar types of reminders or tools to really ensure that you can access your profile. So whether that's, through an app or through, again, the medication printouts that you get, those are really important to have. And especially as you go to different service providers, to really have a list of all your medications and you're sharing that with the different healthcare professionals that you might be interacting with. Just wanted to share this slide because I think it's a great one in terms of really making sure that we're advocating. So each of us, I think, play an important role in advocating for our own health. And I'm a true believer that it's really important to, empower you with the knowledge, and especially as it pertains to medication. So This slide just outlines some key questions to ask your healthcare professional. So whether that's, again, your nurse practitioner, it might be your physician, or you're transferring to another healthcare professional, just really ensuring that you're an active partner in your health, or you've got someone who's advocating for you. So when it comes to medication, really important to understand, if there's changes, an increase or decrease in dose, or maybe something is being discontinued, really understanding, why is that happening? And really, making sure that healthcare professional is explaining to you why that dose is changing. Question also, do I need to continue to use this medication? Oftentimes I've seen, patients might be on a medication long term, and the reason for the initial underlying reason for them initially being on it is no longer there. It's been treated, but sometimes these things continue. So really, questioning, do I need to continue to be on this medication long term? How should I be taking it? And again, is there an appropriate time of the day? Is there any drug interactions? Or is there anything I need to monitor with this? So certain prescription medications do require maybe some lab follow-up. So certain medications may increase or decrease your potassium levels. So the physician or pharmacist will recommend, some lab follow-up just to make sure everything is within the normal range. And then just important again, just to, when you're sharing information about medications with these healthcare providers, also think about any herbal medications you might be on, any supplements, any vitamins, because there are some interactions with those. And we probably could have a whole other topic on some of those drug interactions, drug nutrient interactions, but really important to share, what vitamins you might be taking, what herbals, and especially, if there's any ginkgo biloba or if there's any St. John's wort, like some of those medications can absolutely interact with your prescription medications as well. So just in summary too, I think when I think about, where we can play a role too, certainly with MS, a really big component is around that symptom management. So really talk to your pharmacist as well about some of those symptoms that you might be experiencing. So whether it's the fatigue, whether it's, the sadness, the depression, sometimes it's the pain, and the pain management is a big one too. Bladder or urinary dysfunction. So there's a lot of things that your pharmacist can do there to really help to support that healthy lifestyle, help to reduce or help to manage some of those symptoms, and hopefully manage those side effects too, and provide you with some good counseling and recommendations around that. The other piece is really around compliance. So if you're finding it really overwhelming, or there's, you're taking a lot of different medications, talk to your pharmacist about how you can streamline it. Is there anything that you can do to, make that a little bit more easier for you and reduce that pill burden? Schedule a one-on-one medication review with your pharmacist and really go through everything. Can talk to them about compliance packaging as well, and how to really organize your medication so it's much easier to remember to take them. And with those compliance packages, it's really nice too, because a lot of them are discrete, and you can, usually just tear off that section that you need for that day, put it into your bag, put it into your purse, and continue on your day. So the drug interactions we talked about, I think we talked about also, the drug nutrient interactions that can sometimes happen. And the other piece too, I just wanted to highlight here, is that pharmacies can also help with safe disposal of any unused or expired medications. So if there's, you need to do a cabinet cleanup of your medications, it's probably good practice, once a year, just kind of go through your medication cabinet, see if you have anything expired. You can actually return those to your local pharmacy, and they'll dispose of them safely for you. There's certain pharmacies that also participate in the sharps disposal. So there's only participating pharmacies on that. So I just included the link there if you wanted to check out which pharmacies can give you sharps, but also as part of that sharp return program. And lastly, pharmacists, not just necessarily all about medication, but also really those non-pharmacological options. So there's a lot of things that they can support with that are not necessarily related to getting a prescription medication or over-the-counter medication, but really giving you some tips on healthy sleep habits, could be around, again, some nutrition or ensuring some pain management strategies as well. And so they can really help to support both on the, medication side, but certainly can support with the non-pharmacological interventions as well. And just to, highlight that there's also pharmacies that they specialize in the specialty medication arena. And, one of the things that we recognize certainly with medications that might be a bit more complex or that are, tend to be a little bit more expensive, that piece around reimbursement is really key. So how do I get access to this expensive medication? How am I going to pay for it? What programs are there to support me? Well, a lot of pharmacies can help to support that. And specifically, I just highlighted here through Rexall, we have a specialty support program that really helps our patients navigate through that, because we recognize too that it can be confusing, it can be complex. So again, connect with your pharmacist and see how they can support you and navigate through, some of these other medications that are, again, a little bit more expensive. Sometimes they're not so easy to procure. So really speak to them about, what that looks like. But they can, support not only providing clinical information, but ensuring that from a reimbursement or any other patient support programs that might exist for these more complex medications that they're there to support, as well as ensuring proper cold chain, because we know sometimes with these specialty medications, they certainly require, proper storage, cold chain, and especially, during that delivery directly to your home as well. So I will pause there. I want to make sure I do open it up, if there is any questions, that we do leave some time. I'm happy to answer any questions. Really want to thank you for this opportunity, and I'll turn it back over to Sue.
Thank you, Heidi, for your informative presentation. I have to say I have quite a lot of notes scribbled down on a piece of paper beside me. We have a few minutes left for questions. Again, please type yours into the chat box and we'll get to as many as possible. I do have one here. Heidi, the question is, I'm not sure how to have a pharmacist. I only have the one for my treatment. I went to the pharmacist for my COVID vaccine, but it's not like the family doctor. Should we approach them and tell them if they can be, and ask them if they can be our pharmacist? I guess someone's just asking how that goes.
Yeah, no, absolutely. I mean, I think if you have, a pharmacist within your local community, absolutely connect with them, see how they can support you through your journey. And, whether that's with, your specialty medication, but it's also, a lot of other things too that come up. And we talked about the symptom management component. So it's really important to have, that individual that can also support in collaboration, of course, with your prescriber and your specialist, but they can really, look holistically at all the medications that you're taking and really support on the symptom management side. So that's where I see they can really play a role, again, whether it's pain management, it's sleep dysfunction, they can really kind of navigate through some of that and provide some really good recommendations, both from, a pharmacological perspective, but also, what are some of the healthy lifestyle recommendations too that they can share with you. So yes, highly encourage you to, connect and get to know that local pharmacist.
Okay, there's another one that I see. It says, I have so much respect for our pharmacists, and I'm aware that each province can have different services. Are there any out-of-pocket fees to use the services, or do the province's medical public health coverages come into play?
Yeah, that's a great question. So for the majority, so the ones that I shared, so a lot of the medication reviews, a lot of the immunizations, a lot of those are covered. Now, there are some that there might be, some pharmacies may have like a charge for like a vaccine that you could get from your physician. Sometimes there is an administrative fee that some pharmacies will charge, but mostly speaking, a lot of these services are publicly funded and there's no out-of-pocket expense, typically speaking. Again, it does vary a little bit depending on pharmacy and province, But generally speaking, for the publicly funded services, like a medication. So if I were to take the example, medication review in Ontario, no, there's definitely no charge for that. And same thing, medication review in Alberta. And a lot of these are not services that are out of pocket expense. The only time there might be is for an administration of immunization or vaccine in certain cases, not all.
Okay, we have another question. This is a good one. When you do a medication review with questions and concerns, does the pharmacist need to report that back to your doctor? And this is a question coming from Ontario.
Yeah, thank you for that question. So absolutely. So when we sit down and go through that comprehensive medication review, and let's say we have a recommendation on, increasing or decreasing a dose, or maybe it's stopping a medication, all of those recommendations absolutely go to the prescriber. And then the prescriber will then say, yes, I agree with that. And they'll send a new prescription then for, that new dose. So absolutely, we work very closely with the primary care physician to get those changes. So if we see that, there might be a drug-drug interaction, we inform the physician, and then, we wait for that physician to, if there is a change in therapy and a new prescription is required, then, at that point we'll dispense and cancel on that new prescription. Yeah, great question.
Okay. I do have some other questions in the curated section. I take several pills in the morning. Are there different sizes of the bubble pack dispensing cards?
They are actually, depending on the brand of the card, the blister card. Typically, again, depending on, you're right, like the size of the tablet or the size of the pill, like sometimes you can fit 4 or 5 different ones in there. Sometimes you can only fit, 3, depending again on the size. But yes, essentially there could be some different sizes depending again on the brand of the blister card. Most of them are pretty similar, but the number of tablets that you can put in the blister card might vary again depending on the medications that you're taking, but there might be different options. So if you're finding that you can't fit them all into one, chat with your pharmacist about some alternatives.
Okay, thank you. The next question is, my neurologist will prescribe a disease-modifying MS drug, but has asked me to decide which injectable I might want to try first. Can a pharmacist help make that decision if I'm not yet connected with an MS clinic?
Absolutely. I think what they can do is certainly, go through the different options. It's not the first time I hear this as well, where, you might have 2 or 3 different medication or DMARD options for you. So they can help to maybe, go through how it's administered, the dosage, what is that going to look like in terms of how many times a day or per week that we need to take it. They can talk a little bit about the side effects. They can talk about the monitoring that's involved. So that might just help to crystallize and help make that decision. It's going to be certainly a conversation that happens in collaboration with the patient and with you to really understand, what is it that you're looking for to in a medication or your outcomes. So, some are fine, taking multiple times a day, others not so much. So really sort of understanding the goals of therapy and working really closely with the patient to determine, what is the best option for you. So in short, yes, have that conversation. They can really walk you through, the pros and cons or the indications and the side effects for each as well.
Okay. Just let me check and see if we have any others. No, it looks like we don't have any more questions at this point. I had a question, Heidi. I'm just wondering what Schedule 1 drugs are.
Prescription medications. Thank you for that. Yeah, you probably saw that in the chart, the scope of practice. Mm-hmm. So that one was checked off under Alberta. So Schedule 1 drug is essentially any medication that requires a prescription.
Okay. Well, it would seem that we've come to the end of our questions. Again, thank you, Heidi, for your presentation. It was marvelous. As we wrap up today's broadcast, we want to remind you about the MS Knowledge Network. I think there's a slide about that. It's staffed by trained navigators who provide consistent, quality information and support. You can connect by phone, email, or live chat through the MS Society's website and know that the interactions are confidential and the information is trustworthy. Navigators can help you learn more about the programming and resources we offer. Plus, they can help you find other community or government supports and programs, and can also get you signed up for the monthly MS Canada e-newsletter. We want you to be a part of the MS community and encourage you to get involved with our programs, services, events, government relations, and volunteer opportunities. These days, connecting with each other is much more important than ever, and more information is available on our website at www.mscanada.ca. If you have any questions or need support for this webinar or any of our education activities, you can reach out to the education team by email to education@mscanada.ca. Once again, Heidi, thank you very much for your presentation. Clearly, the job of a pharmacist is just such a broad job, and it encompasses so many factors. And just clearly, you're a large partner in our healthcare, our individual healthcare. And thank you for all that information today. That was wonderful.
Thank you for the opportunity.
Yeah. So on behalf of MS Canada, thank you for tuning in for today's webinar, and have a great rest of your evening or your afternoon, depending what part of the country you're from. And goodbye. We'll see you another time. Thank you.